Yeah, so a few challenges there. One of them is getting enough cells. Very simply put, as I mentioned, Tregs are only 5% of CD4 T cells, roughly 1% of white blood cells of PBMC. So as you can imagine, there are some trials where they don't acquire enough CAR T cells for the patient. Now imagine starting with a cell type that is 20 times or 30 times more rare. So that's going to be a challenge. So we and others have found better protocols to expand these cells. Some of them actually using inflammatory cytokines, such as TNF-alpha and IL-6. But if you add those to a culture of pure human Tregs, you get up to 100 times more expansion in vitro before infusion to the patient. That's one challenge. The other one, it's kind of shares with CAR T cells, conventional is the target. What is a good target for a solid tumor that will have very high on-target attack, but not very high toxicity? Because there's mesothelin, there's other targets as well that they highly express in cancers, but also express in some other healthy tissues, so to find the balance there. So I'm hopeful that Tregs can actually help that question, because Tregs, they will still make less cytokines than conventional T cells do. So I anticipate there'll be less cytokine release syndrome problems and also less off-target killing by using regulatory T cells instead of conventional T cells. And then I guess the third challenge will be to really understand the mechanism and what phases that will take, because I anticipate that the Tregs, the CAR Tregs, they infiltrate solid tumors, we've shown this, and they kill tumor cells, but that might not be sufficient, right? Again, as I mentioned at the beginning, the solid tumor microenvironment is very immunosuppressive, lots of fibroblasts, extracellular matrix, MDSCs, and so I see the Treg, the CAR Treg, not just as a kind of a Trojan horse that goes and kills tumor cells, but also it's kind of a way to open a door for other cells. So it's been shown before actually in the mouse, they have interferon gamma producing Tregs, and we see our human CAR Tregs make a lot of interferon gamma. It's been shown that interferon gamma producing Tregs, they actually destabilize other Tregs that are not making gamma. And so that's very interesting, right? Because you can imagine that the CAR Treg goes in the tumor and kills tumor cells directly, but also rewires, reprograms the tumor microenvironment to go from a cold tumor to a hot tumor. So now you have more inflammatory cytokines and chemokines. You see a lot of CXCL9, CXCL10 being secreted by these cells. And so now you're basically calling the rest of the troops. So I think you'll still, take a village, if you will, to defeat the solid tumor. And now where the CAR Tregs will succeed, that conventional CAR T cells have failed, is in being able to infiltrate and change the environment and themselves kill and bring other cells to also kill.